This video is designed to provide a patient's introduction to transcatheter aortic valve replacement, specifically by the femoral arterial approach. These are aortic valves. The one on the left is normal, the one on the right is stenotic, and you can appreciate how thickened and calcified the stenotic valve is. This leads to restriction of blood flow from the heart to the rest of the body and a variety of symptoms, which include shortness of breath, chest tightness or angina, fatigue, dizziness, and even passing out. When patients present with symptomatic aortic stenosis, their therapeutic options are relatively limited and include medications, valvuloplasty or dilatation of the valve with a balloon, surgical valve replacement, and more recently TAVR. TAVR can be done via the femoral arterial approach, which we're going to talk about here, and also the transapical approach, which is addressed in a different video. Patients who are candidates are generally turned down for surgery because of high risk, or they're not operative candidates at all. This is an animation of an aortic valve, which looks very similar to the actual aortic valve we saw earlier. With the femoral approach for TAVR, a needle is introduced into the femoral artery, or sometimes a surgical cut down is done. A wire is introduced up the abdominal aorta, across the aortic arch, and through the aortic valve into the left ventricle, as depicted here. Following wire introduction, a balloon catheter is placed over the wire through the valve for valvuloplasty. The heart is paced and the balloon is dilated, and this loosens up the valve a little bit to allow passage of the actual transcatheter system, which is much larger. Vascular dilatation sheaths are then introduced, followed by the retroflex system carrying the valve. This is very carefully placed under fluoroscopy and echocardiographic guidance across the aortic arch and through the valve. The position is very carefully adjusted. The sheath system is withdrawn, then the heart is paced again, the balloon is inflated, and this leaves the valve in place. The system is rapidly withdrawn, and the patient at that time has a new transcatheter valve in place. In general, at that very moment, a restriction to blood flow is ameliorated and normal hemodynamics or normal blood pressure ensue. And as you can see in the animation, the valve looks very much like a surgically implanted valve. Our results have been awesome with this valve. We've had 100% procedural success, and patients have generally done very, very well. For further information, feel free to call 813-55-HEART.